We've been here for 6 years, and I have the privilege also of serving as the medical director of the Hope Clinic that we have here called Centro Médico Internacional Hope. And we've been here for 6 years with this clinic. We also wanted to create something that was sustainable, a sustainable social enterprise. And so we raised funding and we were able to remodel a beautiful old home into a very modern clinic here in Bolivia. And the clinic serves 3 purposes. One purpose is education. In developing countries, there's a lot of mysticism about health, a lot of tradition, a lot of non-evidence-based medicine, and so we're trying to educate our community about health. We're also educating the next generation of healthcare leaders. The second thing that we do is we provide medical care, obviously. We have a walk-in and by appointment 80-hour a week family medicine and urgent care, and we provide medical care for those who have the means to pay for their care. These are patients who would leave the country and go to Chile or Argentina or different areas for simple things like a routine physical exam. We're trying to help them stay in the country and feel confident about their care. And they are confident. Over 2,000 of them are confident last year. And so we keep their healthcare dollars in the country. And those dollars go to support our social programs. But people often say, well, are you working directly to help the poor? Because this is an indirect way to help the poor. You raise the money goes to programs. And the answer to that is yes. Our medical doctors go into the parks where we have our park days with vulnerable families. We provide health care. We have about 18 social programs, everything from education all the way to helping vulnerable families and vulnerable children. And whether they know it or not, they're actually providing for care for people who live in their cities and their communities. When we started doing the immigration physicals for the U.S. Embassy, we needed to be able to test for tuberculosis because there's a very high rate of tuberculosis in Bolivia. And this tuberculosis can kill children and families and individuals. And Bolivia did not have a way of really testing for tuberculosis. So we began to work with the national laboratory. We actually instituted this new test for tuberculosis. And so we've actually had the opportunity to change the healthcare in the whole country of Bolivia. The U.S. Embassy actually was so excited about this that they wrote an article that went to all the embassies in the world about this relationship with the CMI Hope Clinic and the way that we're now testing for tuberculosis. Hope knows that to elevate a country out of poverty, we have to educate. The doctors that go away and train, as many times they stay in these countries that they trained in, they don't come back. And so one of our dreams is actually to create a residency program so that we can train physicians graduating from medical school. We could have an incredible impact on this country because these doctors will stay.
Yo me llamo Marianela Arcani Sánchez, tengo 4 hijos. El mayor se llama Fabián, el menor Brian. Juan a mí me ha ayudado mucho. Puedo hablar más de Ludi porque ella siempre ha estado conmigo. Cuando yo más necesitaba, tal vez por caerme, ella estaba ahí. Es como una hermana, más que una hermana, es un ángel para nosotros, para toda mi familia, para mis hijos, para Brian.
Health programs in many ways. We're the wind beneath the wings of the people who are working in the social programs. And so they see Noel, they see Ludi, they see the workers, and that's who they see. What they don't realize is behind them and supporting them is the work we're doing in the clinic. Not only financially, but the work that we do also to establish ourselves in the community. So, we've got a team of people. We've got 25 people in the clinic. We've got 10 people on the ground, working with our social programs, and we very much work together. We just can't underestimate. We've been given a lot, and we have a lot to give.